day, my name is Mohamed India Malone, a nursing student from Notre Dame of Tacoron. So today I will be going to return and demonstrate the prenatal care and Leopold's maneuver. So the equipment that we are going to use is the measure, mother-baby book, tetanus toxoid, and also the 3cc series. So let's proceed to the first procedure. Identify the client and explain the procedure. Rationale, this is to prevent the errors and enhancing the client to be cooperative and funds his confidence. Second procedure is assess the health history, which is includes the personal, family, social, and previous obstetrical and present obstetrical data. Rationale is information gathered by the healthcare provider will help establish baseline data and identify teaching needs. So the third procedure is assess the client's knowledge on the guidelines for health, pregnant, and antepartum care. So rationale is this is to provide the baseline data. Number four procedure is assess the clients. I review the plans for antepartum care visits. So and examination and laboratory findings to serve as baseline data for successful prenatal care. So kailangan natin tingnan kung yung mga laboratories ni mother and kanyang mga ultrasounds. Next procedure is assess the vital signs and assess the vital signs of the client to provide the baseline data for future comparison. So first, assess muna natin vital signs ni mother, pregnant. So kailangan natin ng BP, pulse rate niya, at saka respiratory rate. So, proceed tayo sa next procedure, which is the measure the height and the initial visits, monitor the weight and succeeding visits. So, rationally weighing the important of each prenatal examination gain and decrease weight and will affect pregnancy. So, bago natin mapahinga si mother, dapat na measure natin yung height niya and sa kanyang uh, weight. So, next procedure tayo, conduct the physical examination, begin assessing from head to toe. So this is to come with the with the general impression of a woman's health and well-being. So i-assess natin from head to toe, si patient. And the next is instruct the client to avoid bladder. Rationale, this is to promote comfort the part of the client. Ma'am, baka gusto niyo pong umihi muna, so pwede po kayong pumunta ng CR. Pero kung okay na po sa inyo ganyan, sige, proceed na tayo. So next is position the client in a dorsal recumbent position. Okay, this is the proper positioning relaxes both mother and baby, and it also facilitates the easy and location, presentation, and the life of the fetus. So, assist muna natin si mother sa kanyang position, dapat naka-recumbent position. So, okay na yan siya. Next is drape the client and drape and expose the abdomen from the level of the xiphoid down to the symphysis pubis. So, this is to provide privacy. Measure the measure the fundic height using a tape measure. So this is to determine the gestation and growth of the fetus. And then the centimeter side of the tape measure must be facing the abdomen while inside facing the examiner. This is to prevent the bias. Also locate the highest point of the fundus and leave hand in place and secure the end of the tape measure. Then fundus measure down to the top of the symphysis pubis to measure the fundic height correctly. So using the centimeter, yun yung gagamitin natin. So start tayo sa xiphoid papuntang symphysis pubis. So 19. 19 lang ang ni mother. So next procedure na tayo is next is perform na tayo ng Leopold's maneuver. So to assess the condition and the fetal presentation. So what we're going to do is warm two hands by rubbing the one against the other before placing turn on the abdomen. So the use of warm hands during the palpation prevents tension and hardening of the abdominal muscle, favoring the results. So perform the four maneuver. During the first maneuver and examine standards at the side of the client uh, in bed position. In face the client. So rationalis, the position favors accurate performance of the maneuvers. So let's proceed to the first maneuver, which is the fundal grip. So first is um, with both hands, palpate the upper abdomen and the fundus. For the consistency, head is round and hard breeds. Then is well defined. Then the mobility, head moves, then independently breathes less mobile. Then to determine the fetal part of the fundus. So, dito muna tayo first mag-palpate. Okay. Okay. So, next maneuver naman tayo, the second maneuver, which is the umbilical grip. So, with both hands moving down, then palpate the side of the uterus from the top to bottom. And rationale is to determine the fetal heart. Fetal heart tone usually found in the left lower abdomen. So, palpate muna tayo. Sa left side, dapat ang si right side muna mag-palpate. Next is steady si right side and palpate si left side na hands. So, let's proceed to the third maneuver, which is the Falkins grip. So, with the right, with the right hand, over the symphysis, identify the pressure, and the part grasping the lower abdomen, and this is to determine the engagement of the presenting part. So dapat ang right side natin na kamay is dito siya para malaman natin kung ang ulo ni baby ba ang nauna or kanyang uh, yes. So the last procedure is the fourth maneuver, which is the pelvic grip. So the nurse alters position by turning towards the patient with both hands. Then assess the feet with assess the hand, assess the descent presenting part by locating the cephalic prominence of growth. So rationale is to determine the degree of flexion of the fetal head. So ang last procedure natin is dapat na dito tayo sa ulo ni patient banda. So dapat dito na. No, okay. So now the next is the reposition na natin si client. So ma'am, upo na po tayo. Then, okay. So let's say nakaupo na si patient. So next is administering the tetanus toxoid vaccine, which is the TT1, TT2, TT3, and the TT4. Rationale is to prevent both the mother and the newborn from tetanus. So next is administration of iron supplement until the second month of the postpartum. So rationally, women are most likely um, to develop to rationally is to regain iron lost during the childbirth. Next is administration of malaria prophylaxis to all pregnant women. So these women are most likely to develop the malaria, and we can malaria pregnant can cause the miscarriage and premature labor and small babies. So next is provide and promote health teaching to the client to ensure the optimum environment for health growth development. So next slide is discuss the client and her expectation about the pregnancy. So personally, psychological assessment is important to assist the client and identify areas of mm, the need and yes, the need. So 29, number 29 na is plan with mother and prepare for breastfeeding baby to to know if advantages of breastfeeding to the newborn. The last is discuss the importance of prenatal and subsequent visits for the follow-up care. So thank you and good day.